You're home alone. You feel a pressure in your chest, something strange, but not exactly painful. You think about waiting. But at this very moment, your heart is calling for help. And time is working against you. 7 out of 10 fatal heart attacks happen at home. And most victims are alone when it starts. What you do in the next 5 minutes could determine what happens in the next 5 decades. Would you know what to do? This video can prepare you for the worst and give you a real chance to survive what comes next. Heart attacks don't choose a time or place. They just happen, often with no clear warning, no time to call for help. And when you're alone, every second matters. Most people who suffer a heart attack at home hesitate. They downplay the signs. Try to rest or take a shower to see if it passes. But that silent wait can be deadly. If you're over 50, care for someone in that age group, or have a family history of heart disease, this video is for you. Here, we'll walk you through exactly what to do in the first critical minutes of a heart attack when no one else is around. No scare tactics, no medical jargon, just clear, practical steps that could save your life or someone you love. This isn't generic medical advice. It's a survival guide. Direct, actionable, based on real emergency protocols used in hospitals, adapted to the reality of facing a crisis alone. You'll learn how to recognize the signs, react without wasting time, and prepare before anything even happens. Because when it comes to a heart attack, what you know might be the only thing standing between life and death. The silent danger. How a heart attack really starts. Most people picture a heart attack as something dramatic. Intense chest pain, someone collapsing unconscious. But in reality, it rarely begins that way. Most heart attacks arrive quietly, with symptoms that seem harmless or even confusing. That's exactly why so many lives are lost, because the signs are underestimated or misread. The most common symptom, yes, is chest pain or pressure, but it's not a sharp pain, like a stabbing wound. It's usually a feeling of tightness, heaviness, or discomfort that may radiate to the left arm, jaw, back, or even the stomach. Sometimes it's just a vague discomfort like indigestion. Other symptoms are even less obvious. Sudden shortness of breath, even while at rest. Dizziness or lightheadedness. Cold, clammy sweat, even in a cool room. Unexplained nausea or vomiting. A strange sense of anxiety or restlessness with no clear reason. Sudden fatigue, like your body is shutting down. In women and older adults, the symptoms are often more subtle. Instead of the classic chest pain, they may experience only extreme tiredness, nausea, or a vague feeling that something's not right. That's the danger. The more subtle the heart attack, the more time is lost trying to figure out what's going on. And that time is everything. Imagine a small candle burning inside your heart. It starts tiny, but if no one blows it out quickly, it turns into a fire. That's the heart attack. And the chance to stop it begins the moment the symptoms appear. At this point, your body is already trying to warn you. It's as if it's saying, act now or there won't be a later. The question is, will you know how to listen? Understand why the first 5 minutes are the most dangerous and the most valuable. That's when the line between a close call and a tragedy is drawn. The first 5 minutes, when every second counts. When the first signs of a heart attack appear, your body starts a race against time. At that moment, what you do or don't do can determine whether you survive and in what condition. This is what emergency medicine calls the golden hour. But within that hour, the first 5 minutes are the most critical. During a heart attack, one of the arteries that supplies blood to your heart becomes partially or completely blocked. That means part of your heart is starting to die from lack of oxygen. The longer the blood flow is cut off, the more heart tissue is damaged, and the less chance the heart has to recover. And here's the problem: most people wait. They convince themselves it's nothing serious, that it'll pass, that it's just anxiety. Some try to sleep it off. Others take a hot shower or reach for random medication. All of this wastes precious minutes. Studies show that your chance of survival drops by 10% with every minute that goes by without proper care. That means if you wait just 10 minutes before acting, you've already cut your chances of survival in half, or doubled your risk of serious complications. That's why the biggest mistake is losing time in doubt. Even if the symptoms aren't classic, even if you're unsure whether it's really a heart attack, the recommendation is always the same: act as if it is. Because if it's not, you played it safe. But if it is, you just saved your own life. It's like a fire alarm. No one gets upset when it turns out to be a false alarm. But when it's real, you need to act fast. The truth is, your heart won't wait. And help might not arrive in time if you don't take the first step. Knowing that the first minutes are critical changes everything. It changes what you choose to do. It changes how you read the signs. And most of all, it changes your future. Now let's learn exactly what to do, step by step. If you're alone and suspect you're having a heart attack, these are simple actions, but they could mean everything. The survival protocol: immediate step-by-step action. You're alone. You feel chest discomfort, maybe a cold sweat, a bit of dizziness. You're not sure if it's a heart attack, but something inside you says something's wrong. This is the moment to act, no hesitation. What you do right now could be the thin line between life and death. Here's the survival protocol: a step-by-step guide to respond with clarity and speed, even under pressure. 1. Call emergency services immediately, 911 or your local number. It doesn't matter if you're unsure, call. The dispatcher will ask questions and assess the situation. Give your full name, exact address, symptoms, and mention that you're alone. If possible, unlock your door and keep your phone close by. Important: do not try to drive or wait and see. You don't have time to second guess. 2. Chew a regular aspirin, 300 to 325 milligrams, unless allergic. Chew it, don't swallow whole. This helps the medicine work faster by starting to break down the clot blocking your artery. Aspirin won't stop the heart attack, but it can greatly increase your chance of survival until help arrives. Note: never take it if you're allergic or have been told not to by your doctor. 3. Sit on the floor with your back supported, preferably against a wall. You may feel dizzy or lose consciousness. Sitting with support prevents falling and reduces strain on the heart. Standing or walking increases the risk of collapse. Sit down, breathe deeply, and conserve energy. Your goal is to keep your body stable until help arrives. 4. Keep your phone in hand. If possible, activate the emergency function on your phone. Many devices have shortcuts to send auto alerts with your location or quick dial emergency contacts. Some smartwatches can detect falls or abnormal heart rhythms. Use technology to your advantage. 5. Don't try to be strong. This is a common mistake, especially among men, pretending everything's fine. Being strong here means recognizing the danger and asking for help. You don't need to prove anything. You need to survive. 6. If you're in a public place and symptoms begin, tell someone immediately. Ask them to call for help. Say you might be having a heart attack and need urgent assistance. If you lose consciousness, that information could be vital for first responders. Being clear saves time, and time saves lives. 7. Keep your mind in control. Fear can trigger anxiety and make your heart race even more, making things worse. Breathe deeply. Inhale for 4 seconds, hold for 2, exhale for 4. Repeat this. You need to keep your brain oxygenated and focused. Staying calm right now is just as vital as any medicine. It may sound like a lot, but all of this can happen in less than 5 minutes. These are simple actions that, if mentally rehearsed, can become second nature. That's why it's so important to memorize this protocol, practice it in your mind, and discuss it with your family. Having a plan gives you power. And in this case, power means surviving until help arrives. Now let's look at the most common mistakes people make during a heart attack, and why avoiding them can be just as important as knowing what to do. What not to do. Mistakes that cost lives. Knowing what to do is essential, but knowing what not to do can be even more crucial. Many heart attacks become fatal not just because of their severity, but because of the wrong choices people make in the early moments. Here are the most common and dangerous mistakes you must avoid at all costs. 1. Don't try to drive yourself to the hospital. Even if the emergency room is nearby, getting behind the wheel during a heart attack is extremely risky. You could pass out on the way, cause an accident, or delay proper care. Call an ambulance. They have life-saving equipment and trained professionals that a car doesn't. 2. Don't take a shower to relax. A lot of people head straight for the shower when they feel unwell. Hot water can lower your blood pressure even more and make things worse. Plus, the risk of falling in the bathroom is high. Standing in a slippery space isn't safety, it's danger. 3. Don't wait to feel better. I'll wait just 5 more minutes. That kind of thinking can kill. Every minute of hesitation lowers your chances of recovery. Even if the symptoms go away, seek medical evaluation. A heart attack can start, pause, and come back even stronger. 4. Don't hide your symptoms out of fear or embarrassment. Don't downplay what you're feeling just to avoid alarming others or seeming weak. That only increases your risk. Your life is worth far more than any moment of discomfort or pride. Avoiding these mistakes can mean gaining time, preventing permanent damage, or simply staying alive. Prepare before any symptoms appear by creating an environment and a plan that can make all the difference when it matters most. The silent kit. Prepare before the scare. You can't predict a heart attack, but you can prepare for one. Quiet preparation, done before anything happens, is what turns panic into action. It's what separates those who freeze from those who survive. Having a plan saves time. And in this context, time means a heartbeat staying strong or fading away. That's why the best way to protect yourself, especially if you live alone or have a heart condition, is to create a small, invisible survival kit. Simple, affordable, but incredibly effective. 1. Keep aspirin in plain sight. Store regular aspirin, non-enteric coated, in key spots: your nightstand, purse, kitchen, bathroom. Remember, it must be chewed, not swallowed, at the first sign of symptoms. You don't want to waste time searching for it. 2. Emergency card with medical info. Prepare a simple sheet with full name, age, medical conditions e.g., high blood pressure, diabetes, medication allergies, emergency contact numbers, insurance ID if applicable. Keep it in a visible place, like on the fridge or next to the phone. 3. Set up your phone's emergency feature. Most smartphones have shortcuts for emergency calls or automatic location sharing. On some devices, pressing the side button several times activates SOS. There are also free apps that work as panic buttons, especially useful if you live alone. 4. Mentally rehearse the step-by-step. Picture yourself recognizing the symptoms and taking action. This mental exercise helps your brain automate decisions under stress. You won't have to think, you'll just respond. 5. Organize your space. Avoid locking interior doors. Keep emergency lights charged. Let trusted neighbors know you have risk factors and that they can step in if something seems wrong. Preparing doesn't mean being pessimistic. It means being practical. This invisible kit may never be needed, and that would be the best outcome. But if the day comes, it'll be there, a silent plan, ready to protect your life without asking permission. Now discover a real-life story that shows how these simple actions can change everything, turning fear into survival. A true survival story. Hearing a real story can turn knowledge into emotion, and emotion into action. I want to share with you the story of Mrs. Maria, a 62-year-old woman who lives alone and went through a heart attack that could have been fatal, but wasn't. It all started on an ordinary morning. Mrs. Maria felt a mild pressure in her chest, which she initially mistook for heartburn. It was a strange sensation, a mix of unusual fatigue and a slight cold sweat. She remembered the guidance she had seen in a video much like this one. And despite the fear, she chose not to wait and see if it would go away. She picked up her phone, calmly called emergency services, and explained her symptoms. While waiting for the ambulance, she chewed an aspirin she always kept on her nightstand, sat on the floor with her back against the wall, and focused on controlling her breathing. Just a few minutes later, the ambulance arrived. Paramedics confirmed that she was having a heart attack. Thanks to her quick action, Mrs. Maria received treatment in time, suffered minimal heart damage, and made an unexpectedly fast recovery. Now imagine if she had ignored the signs, waited to see if they passed, or tried to drive herself to the hospital. The chances of a fatal outcome would have increased dramatically. Her quick thinking, use of aspirin, and calm response were life-saving. Mrs. Maria's story isn't unique. There are thousands of similar cases. But what separates those who survive is preparation and the decision to act fast. You can be that person. Remember, when symptoms appear, every second matters. Having a plan, and trusting it, could be your salvation. Now that you know the details, let's reinforce what truly matters so you're prepared if a heart attack happens, whether you're alone or caring for someone else. First, recognize the signs. They're not always obvious, but they must be taken seriously. Chest pain or pressure, shortness of breath, cold sweat, dizziness, nausea, or sudden anxiety. Don't ignore these symptoms. Second, act immediately. Call emergency services, chew an aspirin if there are no contraindications. Sit down with your back supported and try to stay calm. Hesitation is the enemy of survival. Every minute lost reduces your chances. Third, prepare before the scare. Always keep a silent kit within reach. Aspirin, medical contacts, a phone with emergency features activated. Visualize the steps, Mentally rehearse them and organize your space to allow quick action. Knowing what to do is power, and that power is the best protection you can have for yourself and your loved ones. Remember, you may not be able to prevent a heart attack, but you can prevent death by knowing how to respond. Your life, and the life of someone who depends on you, can be saved by these simple actions. Don't let this message go unnoticed. Now it's your turn. If this video can save even one life, it will have fulfilled its purpose. Now the responsibility is yours. Share this content with your family, friends, and especially with anyone over 50 or with a history of heart problems in the family. The more people know how to act quickly, the more lives can be saved. Don't let fear or lack of information determine a fate that could be avoided. Leave a comment if you've been through a similar situation or know someone who needs this guidance. And subscribe to the channel to receive more videos that can make a real difference in your health and the health of those you love. Remember, life-saving knowledge is just one click away. Use it, share it, and most importantly, put it into practice. Your action today could be the difference between a scare and a second chance.